Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I am going to discuss about the face. So, the general aspects of the face, then the muscles, vessels, and the nerves of the face. Now, our learning objectives for today will be an introduction about the general features of the face as a whole, followed by that I will be discussing about the muscles of facial expression, then the blood supply, then the motor nerve supply, then the cutaneous innervation of the face, venous drainage, and applied aspects. Now, let us first try to understand the general features about the face. Now, we all know that face is the index of mind. So, the face extends from the hairline, in the scalp where the hairline starts, up, that is the upper border, and lower border is to the chin and the lower border of the body of the mandible. We call it as the base of the mandible. At the sides, it is up to the auricles. So, limited by the auricles on each side. Now, if you look at the head as a whole, it has got a viscerocranium and the neurocranium. So, neurocranium is the skull which actually lodges the brain, which is large compared to the viscerocranium. So, viscerocranium in humans is smaller, whereas the neurocranium is larger. So, this is one main difference you come across between the lower forms and the humans. Now, the large aspect of the neurocranium is mainly because of the development of the brain and very especially the cerebral cortex. So, the cerebral cortex is the highest center and it is very well developed in the humans. So, that is one main reason you can see. Then other things is the mandible is actually pushed backwards. The lower jaw is not protruding. Only the chin protrudes. So, our chin actually protrudes, whereas the remaining part of the mandible is actually pushed backwards. Not only that, our alveolar arches are wide or broad, and our palate is an arched palate. So, this makes the oral cavity roomy, more room for articulation of the speech. Okay. So, for articulation of the speech, mainly what happens is the palate is arched and the alveolar arches are broad because we communicate through speech. Again, humans only mainly communicate through the speech. Then, the eyes, if you look at the lower forms in the dog or cat or in the birds, it is set at the sides. But slowly in humans, it has migrated almost paramedian in position on either side of the midline. So, thereby you get a stereoscopic vision. So, both the eyes, what happens, can focus and you get a wider area of view. If the eyes are set more laterally, then what happens is the right eye can see something which the left eye cannot see, and what the left eye sees, the right eye cannot see. Okay, so that is why for a stereoscopic vision, the eyes are actually more anteriorly migrated, and the external nose is prominent in humans. So, the nose actually, what we have is the bridge of the nose, tip of the nose, all are actually characteristic features of the humans. Okay, it is very much sharp. Okay, whereas the nostrils or the openings is large in case of the lower forms, and the sense of olfaction, which is different, that is actually very well developed in case of the lower forms. For us, the olfaction actually, what happens is it has become more of a vestigial type, the olfaction, That is because the other functions have actually taken over in case of the humans. Okay, then the majority of the face is actually developed from the branchial apparatus or the pharyngeal apparatus. Okay, so the second branchial arch, the mesoderm of the second branchial arch is mainly responsible for the development of the muscles and actually the bones of the face. And not only that, from the branchial arch and also the neural crest cells also migrates to the viscerocranium. So from the neck, they actually migrate to the face and scalp, the muscles. So the landmarks of the face, you are able to see here. So this is actually called as the eyebrows. In the skull, we call it as the superciliary arch. In between these two, the glabella, the place where the root of the nose is actually called as the nasion. This is the bridge and the tip of the nose. These two lateral expansions are called as the ala of the nose, and this is called as the columella. These are the external nostrils. Now, the eyelids are actually called as the palpebrae. So, actually the opening between the two palpebrae is called as the palpebral fissure. And the medial angle is called as the medial canthus. And this is actually called as the lateral canthus. This is upper lip or labial, lower lip. And they meet at the angle of the mouth. So, you have the two angles of the mouth. The center part of the upper lip is depressed and it is called as the philtrum. This is actually called as the philtrum. Okay. And then this is your chin region, symphysis menti. This is actually your base of the mandible, which is the lower limit of the face. Upper limit is the hairline. This is the temple region and your external ear or pinna. So the pinna has again got parts, individual parts, which we will discuss in the ear class. Okay. So with this introduction about the parts of the face, so let us pass on to the other characters. So what are all the superficial structures present in the face? The skin itself is very lax and elastic skin. Okay. And highly vascular. So rich blood supply, and also it has got a highly sensitive. So very profuse nerves, cutaneous nerves, abundance they supply. So very sensitive to even a very mild touch. So all sort of sensations the face is able to recognize even in very precisely and in minor quantities. So it is also rich in sebaceous glands and sweat glands. The skin is rich in the sebaceous and sweat glands, and the secretions of these sebaceous glands are actually controlled by the hormones. Okay. So mainly you are able to see the sebaceous glands. Now what happens is, if actually the secretions are actually built up because of the clogged pore. So when the pores are actually clogged or they are actually obstructed, then naturally the secretions can actually build inside, and which leads to a, we call it as pimple or acne. Now this is mainly, as I told you, hormonal, because acne usually appears at the time of puberty when there is a surge in the hormones. And again, distribution of hair in the face, mainly as the beard and moustache, is seen in the males, that is also post-pubertal. Secondary distribution, secondary sexual character, especially in case of the males. Okay. Then, as I told you, acne is the retention of secretions. When the sebaceous glands are actually not able to release its contents, it forms a cystic small swelling, which is actually called as the acne. And as I told you, this is mostly seen in the pubertal age, as the individual attains the pubertal age, puberty. So the skin is very lax and elastic, so it can stretch enormously. Okay, and any lacerations or cut wounds of the skin, they gape widely because of the absence of the deep fascia. Okay, and the muscles are attached to that. So what happens is the wounds, they actually open very widely because of the absence of the deep fascia, and the muscles are directly attached to the skin of the face. Now, deep to the skin, as I told you, the face lacks the deep fascia. The superficial fascia is there, and you have the distribution of the fat all over the face. But at certain parts, what happens is the fat is absent, especially over the eyelids. Okay, so the fat is absent over the eyelids, and it is also the nostrils. The skin is directly attached to the cartilage and also the pinna. So pinna is again made up of elastic cartilage. Okay, so these places, and of course your lips, the fat is actually absent. Okay, over the nose, eyelids is absent, but abundant mainly over the cheeks, especially in children. You can see the buccal pad of fat. So that is why we actually refer to it as the chubby cheeks. Okay, when there is an abundant fat over the cheeks, it is actually, we refer it in a common term as the buccal pad of fat. If it is there, we call it as the chubby cheeks. So the muscles are actually present immediately deep to the skin, and of course between the muscles, the vessels, they run, the vessels of the face. So these muscles are actually supplied by motor nerves. That is, the facial nerve is the motor nerve of the face, and it is also supplied, the skin is supplied by the cutaneous innervation. So the cutaneous innervation of the skin of the face is also very, very extensive and profuse. So there is no deep fascia in the face except over the parotid region, which covers the parotid gland. You have the parotid fascia, and over the buccinator you have the buccopharyngeal fascia. But again, the buccopharyngeal fascia, some authors, it is actually a content of a debate, because the existence of such fascia is challenged by certain authors, because again what happens is it will restrict the movement, the buccinator muscle. Okay, so the existence of buccopharyngeal fascia is also not accepted by a few. So except over the parotid region, the deep fascia is absent all over the face. So now deep to the skin and the superficial fascia, we will now discuss about the muscles of the face. So we all know that the muscles of the face, we call it as the muscles of facial expression. Okay, the muscles of facial expression. These muscles of facial expression, they are only a secondary function, but their primary function is they are concentrated around the three openings of the face. Okay, that is around the palpebral fissure, that is the eyelids. Then it is concentrated around the nostrils or the external nose and the oral fissure. Okay, so they act as sphincters and dilators of these three openings. Okay, there are also muscles with respect to our auricle or pinna, but again these muscles are vestigial in case of humans. But certain individuals, they can actually move their auricle or pinna by contracting these muscles through practice. Okay, so mainly the muscles around the fissure, palpebral fissure, oral fissure and the nostrils, they act as sphincters or dilators. Okay, so mainly these three openings they regulate. That is the primary function of the muscles of the face rather than the muscles of facial expression. Rather than the muscles of facial expression. So now let us actually discuss about the muscles of facial expression, how they are categorized. And all these muscles are attached to the skin and they are developed from the second branchial arch. So they overgrow the first arch. First arch gives rise to your mandible and the muscles of mastication. Second arch only gives rise to this facial muscles. They actually overgrow, okay, these first arch, and they actually are present around the face, and these are mainly phylogenetically developed from a single muscle which is called as the panniculus carnosus. Okay, so they are developed from a single muscle which is called as the panniculus carnosus and supplied by the facial nerve, which is the nerve of the second branchial arch. So any structure muscle which is supplied by the second branchial arch is actually developed from the supplied by the facial nerve is actually developed from the second branchial arch. So even though the muscles they migrate to the other places, they drag the nerve supply along with them. For example, the platysma is in the neck, but again it is supplied by the facial nerve. So we can come to a conclusion that it is actually developed from the second branchial arch. Your posterior belly of digastric, okay, is from the second pharyngeal arch. Then your stapedius muscle, which is in the middle ear cavity, that is also developed from the second branchial arch. So these are all the muscles mainly around the eyelids. Occipitofrontalis, you have Orbicularis Oculi and corrugator supercilii. Then procerus nasalis and depressor septi. Nasalis cannot be divided into compressor naris and dilator naris. The external nostrils, the openings can be closed or opened. This also certain persons can actually do this. Then around the majority of the muscles are actually around the oral fissure. Zygomatic major, minor, levator labii superioris, aliquinaceae, levator labii superioris, angulioris. They are all named based on their action or where they are attached. Levator means elevating the labii, lip, superior lip. Okay, and it is also extending into the nostrils, extending into your external nose. So same way depressor angulioris means depresses the angle of mouth. This depresses the lower lip. You have the Buccinator, Orbicularis, oris, rhizoris and mentalis. Now, it is not necessary or not possible to discuss the origin and insertion of all these individual muscles. So I will discuss mainly three muscles in detail, which are of prime importance when compared to the other muscles. So the first muscle which we are going to discuss is the Orbicularis Oculi, which is surrounding the palpebral fissure. It is made up of three parts. So you have an orbital part, you have a palpebral part, and then you have a lacrimal part. Now, the orbital part, if you look at it, it arises from the medial palpebral ligament. The fibers actually are elliptical in nature and they don't have any lateral attachment. Through a continuous concentric ring, they again come to the point of their starting. So arises from the medial palpebral ligament and also from the adjoining frontal and maxilla. Okay. The next is the palpebral part. It is actually present within the eyelids. So eyelids, again you see a superior and inferior tarsal plates. So they pass over that and get inserted into the lateral palpebral raphe. From the medial palpebral ligament, they get attached to the lateral palpebral raphe. So that is about the palpebral part of the Orbicularis Oculi. The next part is the lacrimal part. So the lacrimal gland is actually situated in the superior lateral part of the roof of the orbit, whereas the draining apparatus, the lacrimal apparatus, is actually situated medially. Okay, so it is made up of lacrimal punctum, then lacrimal canaliculi, and then the lacrimal sac. Then it continues as the nasolacrimal duct. Now, the lacrimal sac is actually situated in the lacrimal fossa. Okay, so you have a fossa in the lacrimal bone, and you have a raised margin which is called as the lacrimal crest. The muscle arises from the fascia covering the lacrimal fossa, lacrimal fascia, and the lacrimal crest. So here you will be seeing the lacrimal crest. Okay, so from the here you are able to see the lacrimal sac and the fascia which is covering it. So from that the muscle takes its origin and they actually pass through the tarsus, superior tarsus and inferior tarsus to get attached to the lateral palpebral raphe. Now what is the main function is, the tears which are secreted superolaterally, by the action of the contraction of these muscles, what happens is the tears are drained medially. So it helps to dilate the sac and helps in the drainage of tears. Otherwise, what happens is the tears will overflow from the lateral part of our eyes. So let us try to actually list out the actions of the orbicularis oculi. Mainly the orbital part is responsible for tight closure of your eyelids. Okay, so protects your eyes from excess light. So too much of light, you immediately close your eyes, or somebody is coming to poke your eyes, or some dust falls in your eyes, you very tightly close your eyes. So that is protective in function. The next is the palpebral part. So gentle closure of our eyelid as in blinking. So this gentle closure of the eyelid, the blinking is both voluntary. At our will we can blink, but without our knowledge we blink our eyes at intervals. Okay, regular intervals. So that is about the gentle closure by the palpebral part. Okay, then coming to the lacrimal part, dilates the lacrimal sac, I told you, by stretching the lacrimal fascia and helps in drainage of the lacrimal fluid. So thereby this muscle, through the drainage of the lacrimal fluid, it always keeps your moist. Your cornea is actually kept moist by the helping the lacrimal fluid as a thin film. From where it is secreted to the superolateral, it has to come to the medial part or the medial angle of the eyelid. Okay. So mainly the Orbicularis Oculi is supplied by the zygomatic and the temporal branch of the facial nerve. So this supplies the upper part of the muscle and temporal branch supplies the lower part of the Orbicularis Oculi. So next is ectropion or drooping of the lower eyelid is a condition where the lower eyelid droops. Whereas when there is a drooping of the upper eyelid, it is actually called as ptosis. Okay, so that we will see that in the levator palpebrae superioris, the muscle in the orbit region. I will be discussing about that muscle. Now coming to the buccinator. So the buccinator is actually a quadrangular muscle. Fairly it is present in a deeper plane as compared to the other muscles, and above it you have a buccal pad of fat. This muscle has got an upper fibers, lower fibers, and then it has got an intermediate fibers. Okay, so it is actually the muscle of cheek and also called as trumpeter's muscle or blower's muscle. Okay, so the upper fibers actually arises from the outer surface of maxilla opposite the third molar tooth. The lower fibers arises from the mandible opposite the third molar tooth, and middle fibers they origin from the pterygomandibular raphe. Okay, pterygomandibular raphe, which extends from the pterygoid hamulus to the mandible. Now the upper fibers, maxillary fibers, they pass straight to the upper lip. The lower fibers also they pass to the lower lip. Okay, they get inserted into the lower lip, whereas the intermediate fibers, they cross at the modulus. Okay, they cross at the modulus, and the upper fibers goes to the lower lip and lower fibers to the upper lip. So there is actually a crossing over fibers taking place at the modulus. Okay, so next coming to the action, so it compresses the cheeks, again the teeth and gum, and prevents accumulation of food in the vestibule. Okay, so the action of Buccinator is more of a masticatory muscle than the muscle of facial expression. Okay, so it is also called as blower's muscle or trumpeter's muscle. So expulsion of air from the lips as in blowing or whistling, and its the main function is prevents the accumulation of food in the vestibule, that is between your cheeks and the teeth, the vestibule of the mouth. Food does not get accumulated, it pushes the food into the oral cavity for mastication, and this muscle is actually pierced by the parotid duct, then buccal branch of the mandibular nerve. This is actually a sensory nerve, buccal branch of mandibular nerve, and some mucous glands around the parotid duct. So these are the structures piercing the Buccinator muscle. So next muscle which we are going to discuss is the Orbicularis Oculi. So this is a bit complicated muscle because it has got an extrinsic part and an intrinsic part. Okay, it has got an extrinsic part and intrinsic part. The extrinsic part is again having the muscle fibers in 3 strata. So a deeper strata, an intermediate strata, and then a superficial strata. So the deeper strata, mainly you have the incisivus muscle, incisivus superior and incisivus inferior. Okay, and then the intermediate strata is mainly fibers which are derived from the Buccinator muscle. Okay, so they actually form the intermediate fibers, so transversely oriented, and the superficial fibers are mainly from the Zygomaticus major, minor, levator labii superioris, levator angulioris, depressor labii inferioris, depressor angulioris. All these muscles contribute to the superficial strata of the orbicularis oris. So intrinsic part, actually oblique fibers from the skin to the mucous membrane of the lips. So that is the intrinsic part of the orbicularis oris muscle. So it mainly closes the lips. Okay. The intrinsic part, mainly what happens, compresses the lips against your gum, and the superficial fibers or the extrinsic part are mainly responsible for pouting or pursing the lips, protruding the lips. Okay, so that is the function of the extrinsic part. Intrinsic part compresses the lips against the teeth. So the extrinsic part mainly protrudes the lip. So that is about the orbicularis oris muscle. Now here you are able to see the various facial expressions. So thinking muscle or frowning muscle. Okay, so your frontal belly of occipitofrontalis produces the transverse wrinkles of the forehead. Frowning muscle is by the procerus. Zygomaticus major and minor is actually a laughing muscle. Risorius is a grinning muscle. So all these are mainly responsible for production of various expressions of the face. So these various expressions which we bring about by the facial muscles is triggered by our emotions. So the psychic area of our brain is responsible for producing such type of expressions. And to express our expressions, it is not only through these facial muscles, even we can express through our eyes, extraocular muscles also. Naturally, what happens is when we are anger, you can see through our eyes we can show that. Same way, our tongue also is responsible for producing the expression. So it is not only the facial muscles which is the sole entity of producing such expressions. So our mood, everything can actually be depicted through not only through the facial muscles but also through extraocular muscles and the tongue muscles. So now coming to the nerve supply, first we will discuss about the motor nerve supply of the face. So the motor nerve supply of the face is mainly by the facial nerve. It is the nerve of the second branchial arch from which the muscles develop. Now it supplies all the muscles of the face, whereas one more muscle which you are able to see here, a quadrilateral muscle, is the masseter muscle. So the masseter muscle, even though it is present in the face, it is a masticatory muscle. It is responsible for moving the mandible bone, and it is not supplied by the facial nerve, but it is situated in the face. That is the masseter muscle, which will be discussed under the muscles of mastication. Now, the facial nerve emerges out of the skull through the stylomastoid foramen. Now, after it emerges from the stylomastoid foramen, it immediately enters the posteromedial surface of the parotid gland. Okay, it enters the posteromedial surface of the parotid gland, and it divides into two trunks. Okay, an upper trunk and the lower trunk. But ultimately, 5 terminal branches emerge from the anterior border of the parotid gland. So they are like the spread fingers of our hand. Okay, they are like the spread fingers of our hand. Okay, so from the stylomastoid foramen immediately enters the parotid gland and emerges from the parotid gland as 5 terminal branches. They are the temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch. So 5 branches. We will see these 5 branches one by one. So mainly 5 terminal branches. The temporal branch passes in front of the auricle. The temporal branch passes in front of the auricle, cross the zygomatic arch, and it is going to supply your upper part of Orbicularis Oculi, frontal belly of occipitofrontalis. Zygomatic branch passes in front of the zygomatic arch and mainly supplies the lower part of the Orbicularis Oculi. Okay, and then it also supplies the muscles of the nose. Then the buccal branch divides into an upper buccal and lower buccal branch. So it divides into an upper buccal and lower buccal branch. So mainly the upper buccal branch will supply the muscles of the upper lip. The lower buccal branch will mainly supply the buccinator and the muscles of the lower lip. Then you have the marginal mandibular branch. Because it passes along the lower border of the mandible, it crosses the facial vessels superficially. It passes on top of the facial vessels and it supplies the risorius mentalis muscle. And finally, coming downwards vertically to the neck, which actually emerges through the apex of the parotid gland, is the cervical branch, which supplies your platysma muscle. Okay, cervical branch, because it goes to the neck to supply the platysma muscle, it is called as the cervical branch. So all these yellow ones are the motor branches of the facial nerve, which you are able to see here. So there are also other components of the facial nerve, which I am not discussing here. Mainly this carries your taste sensations. So through the cauda tympanic nerve, and these are all parasympathetic innervations. mainly to your submandibular ganglion and the pterygopalatine ganglion. So now it is very early to discuss about all these things. Mainly today we are concentrating only on the motor branches of the facial nerve in the face. So injury to the facial nerve or lesion, when the facial nerve is cut, it is called as Bell's palsy. That means mainly Bell's palsy is infranuclear lesion of the facial nerve. So what do you mean by an infranuclear lesion? Means, so the facial nerve actually emerges from the brainstem pons where the facial nucleus is present. So each nucleus will receive fibers from the cerebellum. They are called as supranuclear fibers. The supranuclear fibers from each cerebellum projects to both the nucleus. Usually the supranuclear fibers for all the cranial nerves as mainly bilateral projection from the both the cerebral hemispheres. Okay. Now fibers starting from the pons, they are actually called as the infranuclear fibers. So when these fibers are cut, so most commonly any injury to the parotid region, it might be in crushing injuries, facial nerve might get damaged, or in the skull also within the facial canal it might get damaged. So all these can lead to the Bell's palsy. In supranuclear lesions, what happens is, if above the facial nucleus in the pons, above that it is cut, then what happens, since bilateral projection is there, the upper part of the face escapes, that is up till the eye in supranuclear lesions. But in infranuclear lesions, that is the Bell's palsy, the one half of the face is actually completely paralyzed if it is unilateral. So mostly it is unilateral. So the angle is actually pulled to the sound side. Don't think this side is the paralyzed side. Actually it is this side. Why the angle is pulled to the sound side? Because unopposed action of the that side muscles. This side, since it is not counteracting, these sound side muscles become unopposed. The angle is actually, angle of the mouth is pulled to the sound side. Whereas on the affected side, what happens is unable to close your eyelids. Then, so Orbicularis Oculi is not functioning, you won't be able to close your eyelids. Tears tends to overflow because lacrimal part is not functioning. So when the tears tends to overflow, the tears are not actually forming a thin film, so you get corneal ulcerations. Then this nasolabial fold, see here it is very prominent, here it disappears. Okay, nasolabial fold disappears. Buccinator is not actually acting due to its paralysis. Food which is getting accumulated in the vestibule of the mouth, what happens is, starts to, when you try to eat and naturally the food actually comes out, because that is called as the dribbling of the food or saliva, because the buccinator is actually paralyzed. So these are some of the features of the Bell's palsy. Now coming to the cutaneous innervation of the face, I told you it has got a very rich sensory supply. It is mainly by the trigeminal nerve. The three divisions of the trigeminal nerve, ophthalmic, maxillary and mandibular, supply major part of the face and also your scalp. Okay, so scalp in front of the auricle and major part of the face is by the trigeminal nerve, three subdivisions of the trigeminal nerve. So a very small area over the angle of the mandible is mainly supplied by the great auricular nerve, which is from the cervical plexus. So this area is from the cervical nerve, C1, C2, C3 and C4. This area is of the scalp, dorsal rami, C2, C3. So mainly, how do you delineate the area which is supplied by the ophthalmic, maxillary and mandibular? From the lateral angle of eye, you draw a line up to the vertex. From the lateral angle of mouth, you again draw a line to the scalp, reaching the vertex. Then you have three divisions: ophthalmic area, maxillary area and mandibular area. So ophthalmic area mainly supplies your forehead region, upper eyelid and your medial part of your lower eyelid, and then your sides of the nose. Upper lip, ala of the nose, malar prominence, that is the prominence of the cheek, lateral part and temple region is supplied by the maxillary nerve. Mandibular, lower lip, cheek region in front of the auricle is mainly supplied by the mandibular division of trigeminal nerve. Okay, so the demarcation, as I told you, from lateral angle of eye to the vertex, from the lateral angle of mouth to the vertex. So the first area above the lateral angle of the eye, first line is the area for the ophthalmic division by 5 nerves it supplies: supratrochlear, supraorbital. These two, from supratrochlear and supraorbital foramen it comes out. This supplies the medial part of your forehead, and supraorbital reaches up till the vertex of the skull. Okay. Then laterally you have the lacrimal nerve, which supplies the skin over the lateral part of your upper eyelid. Then you have the infratrochlear and the external nasal nerves. So the infratrochlear again supplies your medial part of your upper eyelid, and then you have the external nasal, which mainly supplies the sides of your nose. Okay. So the bridge tip and the sides of the nose is mainly supplied by the ophthalmic division. 5 nerves: supratrochlear, supraorbital, lacrimal, infratrochlear and external nasal. So this is the area which is supplied by the ophthalmic division of trigeminal nerve. Next, mainly coming to the maxillary division. So the maxillary division, 3 nerves. Here you are able to see infraorbital nerve, then zygomatico facial, zygomatico temporal. Infraorbital nerve, again, what happens? It actually divides into 3. One gives a palpebral branch to the lower eyelid. One gives a nasal branch, lateral nasal branch to the ala of the nose, and another branch to the upper lip, labial branch to the upper lip. Zygomatico facial nerve comes out through the foramen of the same name, and mainly it supplies the skin over the malar prominence, so the prominence over the zygomatic bone, cheek prominence. Zygomatico temporal mainly supplies the skin of that region and the scalp adjoining area. Okay, so the mainly area of their supply is your lower eyelid, upper lip, ala of the nose and prominence of the cheek, malar prominence and the temple region. The next, the third is the, below the second line is the mandibular division, which is supplied by the mandibular division again by 3 branches: buccal branch, then you have the mental nerve and auriculotemporal nerve. Mental nerve, which comes out through the mental foramen and supplies the skin over the chin region. Buccal nerve supplies the skin over the buccinator, and auriculotemporal nerve is present in front of the auricle. It supplies your auricle, external ear, anterior superior part, tympanic membrane, and temporal part supplies the skin over the temple and then the scalp. Okay, so buccal, auriculotemporal and the mental nerves. So the area of supply is the pinna, cheek and the external acoustic meatus, as I told you. Now apart from that, the skin over the angle of mandible is mainly supplied by the great auricular nerve. It has got a anterior branch and a posterior branch. What is trigeminal neuralgia? So distribution, pain, excruciating pain or radiating pain, distribution of the pain along the branches of the trigeminal nerve, especially these supplying the face. Sensory distribution is actually called as trigeminal neuralgia. Okay, so mainly severe pain on touching the face might trigger this, and it might be due to many reasons. It might also due to any herpes zoster infections, or even in certain cold climatic conditions it might trigger this trigeminal neuralgia. Okay. Now the treatment is, if the pain cannot be subsided or it cannot be traced, then within the skull the trigeminal ganglion is there. So that ganglion has to be anesthetized by injecting alcohol. So mostly affects the middle-aged people. So now coming to the blood supply of the face. So the chief or the principal artery of the face is the facial artery, which is a branch of external carotid artery. The facial artery is the chief artery, which is a branch of external carotid artery. So after a course in the neck region, cervical region, what happens is the facial artery winds around the mandible to permit movements of the mandible, and then enters the face at the antero-inferior angle of the masseter. So here it pierces the investing layer of deep cervical fascia to enter the face. Then it runs obliquely towards the angle of the mouth and then medial angle of the eye as the angular artery, and anastomosis with the ophthalmic artery. It has got a very tortuous course because it runs within the muscles. Okay, so chief artery of the face enters by the antero-inferior angle of masseter, has got a very tortuous course, and you are able to see. And finally what happens is it terminates at the medial angle of the eye by anastomosing with the dorsal nasal branch of the ophthalmic artery. So the terminal part of the facial artery is actually called as the angular artery. So the branches of the facial artery in the face, in the neck also it gives branches, but in the face, facial artery in the face mainly gives to the lower lip, inferior labial branch. Then superior labial branch. The superior labial branch gives a septal branch to the nasal septum and an alar branch to the side of the nose. This septal branch anastomoses with two other arteries, sphenopalatine artery and anterior ethmoidal artery, and that is called as the Kisselbach's area in the antero-inferior part of the nasal septum. So septal branch takes part in the anastomosis in the Kisselbach's area of the nasal septum, Little's area. So then it gives a lateral nasal to the ala and dorsum of the nose, as I told you. And then finally what happens is it is called as the anesthetist artery, because the pulsations of the artery can be felt superficially and it crosses the antero-inferior angle of the masseter. So that is why it is actually called as the anesthetist's artery. So branches are inferior labial, superior labial, which gives a septal and alar branch, and then a lateral nasal branch. So these labial branches, what happens? They cross the midline and forms a circular anastomosis with the similar branches of the opposite facial artery. Then the other artery which is supplying the face is the transverse facial artery, which is actually from the superficial temporal artery. It is a branch of superficial temporal artery, one of the terminal branch of the external carotid artery. Other terminal branch is the maxillary artery. So from here it mainly supplies blood supply to the skin over the parotid region and then anastomosis with the neighboring arteries. Coming to the venous drainage of the face, mainly it is by the facial vein. So the vein is actually situated posterior to the artery. The facial vein actually is situated behind the artery and again starts from the medial angle of the eye by the union of supratrochlear and supraorbital vein joins to form the angular vein at the medial angle of the eye, which you are able to see here. And the vein actually what happens, follows the course of the artery, and finally it joins with the anterior division of retromandibular vein to form the common facial vein. So the common facial vein is actually formed by the union of the facial vein with the anterior division of retromandibular vein. And finally, the facial vein drains into the internal jugular vein. Okay, so it drains into the internal jugular vein. Now, this facial vein also has some connections with the intracranial venous sinuses. Mainly, it connects with the superior ophthalmic vein and also with the cavernous sinus. So here you are able to see the two communications. So mainly it communicates with the cavernous sinus through superior ophthalmic vein. The angular vein actually has a connection with the superior ophthalmic vein through which it connects through the cavernous sinus. Through the deep facial vein, pterygoid venous plexus, from there again it connects through the cavernous sinus. That is the deep facial vein. Okay. So because of that only the upper lip and the lower part of the nose is actually called as the dangerous area of face. Because any infections through these veins might actually infect the intracranial venous sinuses. Okay. So that is about the facial vein. Finally, we will conclude with the lymphatics. So lymphatics of the face mainly from preauricular lymph nodes and parotid nodes, and then you have the submandibular and the submental lymph nodes. Okay. So submandibular mainly drains the medial angle of the eye, lateral part of your nose, bridge of the nose, lateral part of your lower lip. This medial part of your lower lip gum region is drained by the submental nodes. Skin over the parotid region and mainly superficial area are actually drained by the preauricular nodes. Okay. So that is what preauricular nodes, mainly your cheeks, forehead, it drains. Submandibular nodes, as I told you, lateral part of your lower lip, jaw, medial part of your eyelid, and submental nodes, central part of your lower lip and chin. So that is all for today, and thank you very much for your patient listening.